While medical examiners can provide answers to cause and manner of death, insurance companies don't necessarily have to yield to what the medical examiner reporter says. Sometimes an autopsy may not happen, and a death may be an apparent accident or an apparent natural. But if an autopsy had been done based on the circumstances, or even just based on the circumstances, it's very evident that that death is accidental. The decision by the insurance company could have some serious effects for the family. A good example is a case I had a couple years ago where an individual fell, struck their face, and had serious injuries, was in the hospital for this, had surgeries, multiple surgeries, and subsequently suddenly died in the hospital. The presumption by the hospital pathologist and the local authorities was that it was probably a blood clot or a pulmonary embolism due to being immobilized and having the trauma. And because it was from a fall, that would be an accident. Well, the insurance company had a different take on it because this individual had been on a long air flight prior to coming to this location where they fell. And so the thought was that, well, he had a blood clot from flying on a plane because he was sitting in a chair and it had nothing to do with the trauma. I know, having dealt with this sort of case over the years, that the consensus by forensic pathologists in this sort of case with serious trauma, fractures, immobilization, that is by and far felt to be a consequence of an accidental trauma, as opposed to just a natural event that happens from, say, flying on a plane for a protracted period. So my opinion in that case, being that I felt that the individual's death was due to the accidental fall, had huge ramifications for that family. Ultimately, what we want to find is the truth through the final diagnosis.